third aphorism in Organon of medicine. So the third aphorism is very important and it comes usually as an essay question, that is either as a what are the knowledge a physician should have, or who is a true practitioner of a healing art. So a true practitioner of healing art is a physician who has got the knowledges to treat the patient and bring on cure. So we will see what are the knowledge a physician should have in order to treat. So the first important knowledge is knowledge of disease, then knowledge of medicine, then application of drug knowledge to that of disease. Fourth, knowledge of choice of remedy, knowledge of preparation of the remedy. Sixth, knowledge of proper dose. Seventh, knowledge of repetition of the dose. And eighth, last but not the least, knowledge of obstacles to recovery and how to remove them so that we can bring on cure. We will first start with our knowledge of disease. A homeopath's life is much more tougher than that of an allopath. The reason being, normally in allopathy, if a patient comes, they just take the chief complaints or the complaints of the patient and prescribe a medicine. But for a homeopath, it is not that easy. Once a patient comes, he should have the knowledge of the disease, that is disease in general, that is about the diagnosis. So he should know what disease the patient is having so that he can differentiate it between the common symptoms and the general or the symptoms of that of the individual of the patient. So we have to make two diagnoses, that is diagnosis of the disease as well as diagnosis of the patient. So for knowledge of disease, we have to have, first is knowledge of the disease to be cured, that is disease in general. Then knowledge of the individual to be cured, that is disease in particular. This knowledge is very important because only if you have this knowledge, you will be able to differentiate a characteristic particular from the common symptom of the disease. So that is about the knowledge of disease. Now we will see knowledge of medicine. That is our second, knowledge of medicine. Now how do we obtain the knowledge of medicine? We obtain the knowledge of medicine by doing drug proving. Now you can't understand the qualities of a drug just by the sight, smell or feel of it. You have to study the qualities of drug by proving it on healthy individuals. If you think by giving a drug on one particular healthy individual, we can understand the qualities of the drug, then you are mistaken. It is not possible to study the qualities of a drug by proving it on one person, but it is studied by proving it on many healthy individuals. Now, each person on whom the drug is proved keeps a record of it in a book called as day book. Now, this day book has all the symptoms produced by that particular prover from that particular drug. Now, when many such books are obtained and many such provers, this book is being compared, and then they can find out the particular symptom which repeats itself frequently in all these provers. Now, that becomes the characteristic particular or the unique feature of the drug. If that feature is not there in the patient, you cannot even think of prescribing that particular remedy in that patient. For example, you can take Naxomica. Naxomica is a very good drug for, let it be, mind or GIT complaints or rectal complaints, many such complaints. It's a polycrust. Now, Naxomica's characteristic is ineffectual urging. If this is not there, it is written in boric, it contraindicates Naxomica. So, if a person is not having ineffectual urging or is having no problem with the defecation, then Naxomica cannot even be thought of. Like that same way, if you see Merxol. Now, Merxol is a very good remedy for GIT complaints again. Let it be aphthous ulcer or any problems related to our mouth or glandular disease or complaints related to our rectum or GIT. Merxol is a most commonly prescribed. Of course, it's a polycrust again like Naxomica. Now, if you see Merxol in mouth complaints, there will be increased salivation, and in GIT complaints, you will, in skin complaints, you will see that they will be having moist skin. If the patient has dryness of the mouth or of the skin, then it contraindicates Merxol. You can't think of Merxol in such conditions. So, that's why knowledge of medicine is very important. Now, we have the knowledge of disease, we have the knowledge of medicine. So, what do we do next? We apply the drug knowledge to the disease knowledge. So, the third is application of drug knowledge to that of disease. Now, this important thing which you can of course understand by this is that it has to be based on the law of similars. A drug can cure what it can produce. So, if you see the symptoms, then you can make out those symptoms are there in that particular drug. Of course, then that particular drug is a perfect match for the patient and it will surely bring on cure. Now, we will go to the fourth knowledge.